Senator from Rhode Island.
Madam President, I would ask to dispense with the calling of the quorum.
Without objection.
Thank you, Madam President. We are on the brink of passing meaningful gun safety legislation, and it's regrettable that it took the deaths of 31 people, including 19 children, in the recent Buffalo and Uvalde mass shootings, to provide the needed momentum to break the hold that the National Rifle Association and the gun lobby has had over Congress. I commend my colleagues on both sides who have stepped forward to reach a compromise. This bill is a big accomplishment that can save lives, but I feel an inescapable dread that we will face the horror of another mass shooting if we do not take further steps. As a veteran, I have shot many of the weapons we've heard debated on the floor this week. I know their power, and I know they were designed for killing people. Now, I know that some of my colleagues hold the view that more firearms in the hands of more people is the antidote to gun violence, but I have to ask, will more and more guns and more people carrying guns in public make our schools, our churches, or our streets safer? Is that really a vision for this country? I don't think so. Madam President, according to an academic study by the Council on Foreign Relations, the United States, with less than 5% of the world's population, has 46% of the world's civilian-owned guns. And it has the highest homicide by firearm rate of the world's most developed countries. Indeed, Americans kill each other with guns at a rate 25 times higher than other high-income countries. In addition, Americans use firearms to harm themselves in alarming numbers. According to the CDC, in 2020, there were more than 45,000 firearm-related deaths in the United States, and roughly half of those deaths were suicides. That's the academic data. But what grips me and so many other Rhode Islanders are the mass killings of Americans, particularly children, over the last quarter century. Columbine, Sandy Hook, Parkland, and now Uvalde. Hospitals, concert venues, houses of worship, and military installations have also been targeted. People have been targeted based on race, sexual orientation, and religious beliefs. Innocent lives have been taken again and again, and many more lives have been shattered. The common element is a firearm, and while correlation isn't necessarily causation, these mass killings have been more and more common as more and more guns have been marketed and sold. Roughly 2/3 of Americans do not own a gun, and the majority of Americans agree on a common sense solution like expanding background checks. But groups like the NRA have lined up to block these efforts even in the face of devastating loss. The Bipartisan Safer Communities Act before us today represents progress. It represents a momentary break in the NRA's stranglehold on reform. This bill will establish a 10-day waiting period for firearm purchases for individuals under 21 years of age. It will close the boyfriend loophole that allows abusers to access guns. It will strengthen requirements for gun sellers to obtain a federal firearms license. It will establish clear penalties for store purchases and gun trafficking. And it will invest in violence intervention programs and mental health solutions in communities across the country. Those are real changes that are worthy of support on their own. And I'm also encouraged that the bill includes incentives for states to adopt extreme risk protection orders or a red flag system, similar to the legislation I have introduced. State red flag laws have proven effective in keeping guns away from individuals who have demonstrated clear warning signs of danger to themselves and others, and we should be encouraging every state to adopt a red flag system. I'd also like to talk about the mental health aspects of the bill. First, it needs to be repeated that a person with a mental health condition is more likely to be a victim of violent crime, not the perpetrator. The most reliable predictor of future violence is actually a history of violent behavior, not a diagnosis of mental illness. That being said, we do have a mental health crisis in this country that demands attention. In Rhode Island, families and providers have been asking for more resources for treatment and more training for mental health workers, particularly resources dedicated to children with mental health needs. And I am pleased that the negotiations over the gun control package so far include new resources for mental health care, including a national expansion of the Certified Community Behavioral Health Clinic model, which would provide sustainable funding to expand mental health and substance abuse treatment and services at the community level. And I have worked with my colleagues, Senator Stabenow and Senator Blunt, for over a decade to move this provision forward. I am also pleased that this agreement invests new funding in a national suicide prevention lifeline. Next month, the Lifeline will be making the switch to an easy-to-remember three-digit number, 988. We need to make sure call centers have the staff and capacity to handle call volume and make sure people who reach out for help get appropriate follow-up care. As I mentioned earlier, half of all gun deaths each year are suicides, and firearms are the most lethal method of suicide. In addition to keeping guns out of the hands of people in crisis, we need to make sure that we have well-funded and organized systems in place for people who reach out for help in these times of crisis, like the Lifeline. Again, I would hope every American, particularly those who face these mental health challenges, recall 988. It could be a lifesaver. I hope we're able to consider also bipartisan efforts to strengthen our mental health care system over the coming weeks and months. For example, we should pass the National Suicide Prevention Lifeline Improvement Act, which I introduced with Senator Moran this year. The Help Committee reported the bill out of the committee unanimously nearly a year ago, but this bipartisan bill has still not yet come before the Senate. The bill also includes critical resources for schools, not only to implement measures to address physical safety, but also to ensure that schools have the resources to address the social, emotional, and mental health needs of students and staff. Our educators have not just been on the front lines of the pandemic, and too often, much too often, they're on the front lines of the gun violence epidemic. And they are also on the front lines of our mental health crisis. Finally, because of this legislation, some help is on the way. The gun violence bill we are debating will hopefully prevent some tragedies going forward. Though we cannot help but celebrate any progress on gun violence, we should not lose sight of the fact that we need more comprehensive action than this bill if we are really committed to prevent gun violence in our nation. There is no single law or regulation that we can pass that would have stopped every single one of these tragedies we've seen over the past few decades. But in my view, Congress should do more, including reinstating the assault weapons ban, cracking down on illicit ghost guns, and most importantly, eliminating the near total immunity for the gun industry, which has an unparalleled level of liability protection. The gunman in Buffalo bought a semi-automatic weapon, but he was able to, quote, illegally transform it into a fully automatic weapon. If you go to your cell phone and get YouTube, put in something like transform AR-15 to fully automatic, you'll have a host of videos. One of them lasts 1 minute and 38 seconds. And why is this happening? Well, when you have no liability for the consequences of building a weapon that can be easily translated from semi to fully automatic, and you can wink to your potential market and say, yeah, this is semi-automatic. This legislation is critical to get that immunity dismissed. Now, I'm proud that in the days following the tragedy, my home state of Rhode Island took decisive action by banning magazines that hold more than 10 rounds, raising the minimum age for buying shotguns and rifles from 18 to 21, and prohibiting loaded rifles and shotguns from being carried in public. Congress should do the same by passing the bill before us and then pressing on with additional reforms. I will vote to support this bipartisan bill. It's a significant step, but it cannot be the last step.